everybody, welcome back to another reaction video. In this one, we're going to be checking out the day in the life of a dermatologist. Let's see what it has to offer, and yeah, break it down a little bit.
Hi, good morning. I'm Dr. Robinson. I'm a board-certified dermatologist. I work in Cedar Hill, Texas, which is just south of Dallas, Texas. And thank you for joining me today. I'm going to show you a little bit about what my day is like, okay? All right, so I generally get here just around 8 a.m. And I work 4 days a week actually. So I get here around 8 a.m. on the days that I do work. And one of the first things I do is I review my list of patients for the day. I like to.
So something that always intrigued me when I heard about dermatology is actually the hours of it. It seems really reasonable to work both as a dermatologist and manage a family and have both of those lives equally as important. Being a part of your life. So yeah, starting at 8 a.m. and working 4 days a week is definitely a plus out of a 7-day week, obviously. Obviously it varies between people. It depends on if you run a private practice where you can kind of dictate your own hours, or if you are in a big hospital where you're at kind of the call of people above you, or by the board, I guess, if you're, you know, not as high up in the ranks. But yeah, something that's always intrigued me.
To see who's coming to see me today and what kind of fun we have in store, okay? The other thing that I really like to do in the morning to get ahead of a lot of the stuff that needs to happen today is I like to review any lab or pathology reports that are available. It's just really important as we do biopsies and get information to relay that to the patients. And I have a really wonderful team of staff that really makes that possible on a timely, in a timely fashion. And so I'm going to review those today, and then I will also review any messages from patients because those generally come in throughout the day, and then sometimes the pharmacies like to get in touch with us as well if they're having any issues or questions about prescriptions or if people need refills. So all of that needs to get done in addition to seeing patients. So I'm going to go ahead and get started today, okay?
So it is really nice, obviously, to check up on patient information before you perform anything for that following day, because yeah, obviously people can forget or botch numbers. So yeah, you might think it's one thing that night, and then the next day when you go to perform anything on them, or I guess just relay some information that you got on some tests, to make sure that you're saying the right things. Obviously, rather be safe than sorry, and not relay the wrong information to the patient.
So on a typical day, I generally see anywhere from 35 to 40 patients, and that totally depends on personal preference. Some dermatologists see way more and some dermatologists see fewer than that. And that's one of the nice things about dermatology. You can make it whatever you want it to be. And so that is a very comfortable number for me, and it allows me to take great care of my patients and still get home in time to take great care of my family.
So that's exactly what I'm talking about, how you feel like you can balance your life well in dermatology, and seeing 35 to 40 patients definitely doesn't seem like it'd be a terribly large amount, rather than 75 patients, or also even a smaller number like doing 20 patients, where you'd see each patient for a more allotted time slot, but you wouldn't see as many as a whole during that day, because obviously the goal is to help as many people as you can, help them get better, help diagnose and treat them. So yeah, 35 to 40 patients, not terrible, especially a 4-day work week. I don't know what time she gets out, but if she starts at 8 a.m., it's probably an 8 to 5 or 8 to 4, probably, like 9 to 5, 8 to 4.
So my first patient generally is at 8:30, and so the morning clinic goes until noon, and then we take a lunch break from noon to 1. I usually spend that lunch break charting. I really do have to get through my notes for the day in order to stay on top of everything that needs to happen today. And then we proceed with the afternoon clinic, and usually I'm done by around 4:30 so that I can get home and enjoy the rest of my evening at home. So it's just about 8:30 now, so let's just go ahead and see the first few patients.
So right off the bat, she gets there, tells us a little bit about her day, but yeah, I get started at 8 o'clock from 8:30, or 8 to 8:30 before she actually sees any patient. She reviews everything and all the tests maybe that came back, and she has information before she goes and sees patients. Rounding is what it's called. I mean, in the hospital, I'm sure it's the same thing here, but something I do when looking at specialties is seeing how many people I would see in a day and how long the longest procedure is, seeing if I could tolerate it, and how short the shortest procedure is, because obviously, if I'm doing something like simply diagnosing, it might take 1 or 2 minutes, saying, yeah, this is this, let me feel it, let me, see it. But then it also might take me 10 hours if I'm doing a very specific surgery. So something I do when comparing specialties is seeing how bad I think the longest or worst procedure is. Worst could mean best as well. And then how many people I'd be able to see if every patient I saw was the shortest procedure, to kind of help dictate my day. Yeah, that's why I really like dermatology, because a lot of the procedures aren't like 12 to 15 hours like spine surgery, brain surgery, reconstruction of some type of bones or something like that. Anyways, those can be really long surgeries, and you might only see one patient in your entire day, because you might have that one 15-hour block of a surgery. So.
All right, come on, let's go see some patients. One of the things I love most about dermatology is the wide variety. So on a given day, I can see people of all ages, and I can see a wide variety of conditions that affect the skin, hair, and nails. It's a very procedural specialty, and we perform a wide variety of procedures as well. And so we can do skin biopsies, we can remove warts, skin tags, benign growths on the skin that people just don't like. We also remove skin cancers. So not only do I identify and diagnose skin cancers, but I can also treat them in the office. So that's a really nice thing to be able to offer patients as well.
So that's what I was talking about earlier. The quick procedures is like removing a skin tag, and doing biopsies and stuff, which would be on the quicker side. And then she also talked about specializing in not only diagnosing cancers, but also being able to treat them. And that's a Mohs surgeon, which is something that I was looking at, a Mohs certified dermatological surgeon. That's something that's interest to me. So yeah, this video is already really informational, seeing the short end of the procedures, and then also she's apparently certified to do that as well. So it's almost exactly what I want to do.
All right, so today so far, I've seen patients with acne, I've seen patients with psoriasis and eczema, taking care of a few people with warts and moles and things like that they don't like. And another important thing that we do are consultations for hair loss and cosmetic procedures. So we've done a little bit of that as well already today, okay? The next room I'm heading into is a total body skin exam. And so periodically people will come in to have their skin examined. That's actually a major part of what we do, because as a dermatologist, one of the most important things is to identify skin cancers and precancers, okay? So my patients in the next room, patients generally undressed, and we examine the skin from the head to the toe, okay? If I identify something that's a precancer, we use this device to treat it, and so it can be treated in the office today to minimize the chances that it progresses into an actual skin cancer. And then if I do identify something that looks suspicious for a skin cancer, I'm able to perform a biopsy. And so that will be done in the office today as well, where we take a sample of the skin and we send that to the lab to determine if there is a skin cancer or not, okay? So we're just gonna keep going, okay? And lastly, we do a lot of cosmetic procedures.
Something that kind of surprised me that she was talking about is that she does consultations for hair transplants or something like that, which probably would be performed by a plastic surgeon. But I'm assuming just because it does deal so much with the skin, seeing if your skin is viable and would be healthy enough, I guess, to transfer hair onto, it kind of would make sense that dermatological, resident or physician would be checking that out before they actually send them to surgery.
And so we do things like Botox injections, filler injections. We can perform so we can do that all in the office, in addition to chemical peels and things like that. And I really love that part of my job because it really does impact people and can help improve their appearance and their outlook. And so that's a really great thing that we're able to offer patients. So I'm a board certified dermatologist, and in order to become a board certified dermatologist, you need to complete 4 years of undergraduate or college, 4 years of medical school, and 4 years of residency. And those 4 years of residency is 1 year of a general internship and then 3 years of dermatology specific training. Once you've completed all of that, you are then a board eligible dermatologist. And in order to become officially board certified, you need to then take the board exam and pass it. And that's administered by the American Board of Dermatology. And once you've done all of that, you're then a board certified dermatologist. You're essentially an expert in all things skin, hair, and nails. And that's what I get to do. And that is just one aspect of dermatology. You can choose to subspecialize subspecialize, and a lot of people do. So if you find that you have an interest in pediatrics, you can do an additional year of training where you become a pediatric dermatologist. And that means that you essentially see children and you specialize in taking care of children's skin. Okay, some dermatologists really enjoy surgery and only want to do surgery, or want a practice that is predominantly surgery. And for those people in particular, they can do an additional year of training, and that additional year of training helps them become a Mohs surgeon, and that's a very specialized form of surgery that's done to remove skin cancers and growths on the skin.
That's what I was talking about earlier. There are a lot of specialties, obviously, that you can go into within every, I guess, main group, orthopedics or dermatology or pediatrics, that kind of thing, or cardio, or, plastics, yeah, for that matter. But yeah, that's what I was talking about. Mohs surgeon removes skin cancers and stuff like that in the skin.
Hey, I'm Dr. Robinson. It's good to see you. What brings you in today?
I just want to talk to you about my skin. I have some acne spots and like some little dark spots and blemishes that bother me.
Okay.
They're not bad, but they just make me self-conscious. And then some large pores.
Great. I think we can help with that. Let me take a look. There are also people who specialize in cosmetic dermatology and dermatopathology. So those are also forms, subspecialties within dermatology. So these people trained to become a dermatologist, like I mentioned earlier, and then they spend an additional year focusing on these various aspects. So a dermatopathologist is a dermatologist who learns and focuses on looking at the skin under the microscope. And that's a really important part of how we make diagnoses and how we determine what's going on with skin, hair, and nail conditions, and allows us to choose treatment based on the specific condition. One of the things that we offer is called microneedling. It's essentially...
I'm going to cut this part out now, just for those with a weak stomach. We're going to skip over the actual microneedling procedure that she performs on this woman.
Important to shadow a dermatologist. I see some students who accept jobs as medical assistants with a dermatology practice, and that is really a great way to make money and also to see what it is to be a dermatologist before you go to med school or while you're in med school. So I've had quite a few students do that with us, and I think they found that experience really rewarding, because any redness and dark skin can turn into dark spots, right? Post-inflammatory hyperpigmentation is pigmentation that occurs after inflammation, and redness means there's some sort of inflammation going on, okay? So this is definitely your time to protect from the sun. Gentle soap and water to cleanse the area, and then I'm gonna give you a to-go little tube to put on the area at least twice a day. You can do it more frequently if you need to, if you feel like it's dry and scabby.
Is this my whole face?
Mm-hmm.
Okay.
So the whole face, yes ma'am.
Okay.
And then sunscreen.
Sunscreen.
Okay, awesome. That is it. Obstacles and a lot of struggles along the way, and I think it's really important to have someone to help guide you and help encourage you along the way. I think those two things are really important, really experiencing the specialty and also developing a mentor within the specialty.
All right, so that is it for that. She talked about 4 years of residency is the last thing you do, but yeah, you have 4 years of undergrad and 4 years of med school as well, meaning 12 total, plus an extra year if you want to specialize in something, which would mean 13 total. Before COVID, of course, was able to shadow a gastroenterologist and see a couple of the procedures he did. But yeah, as she did the microneedling there, that was a pretty quick procedure. It took about 2 minutes within the entire video, but I'm sure in real life it probably took 5 or 6, which still isn't a long time by any means, also compared to a bunch of other procedures that you possibly could do. Of course, it's really quick, which totally would make sense why she's able to see 30, 35 patients in a day, and still have enough time to break for lunch, and coming in at 8 a.m., not doing any third shift, working from 10 p.m. to 6 a.m. or something like that, isn't a part of this kind of lifestyle, which I like. Yeah, she sounds really professional. She really knows what she's talking about. Dr. Cynthia Robinson, thank you, of course, to Dr. Webb, who provided this video for me to react to. You can check out his YouTube channel in the link in the description for this video specifically. And yeah, check out more on his page. He himself is a spine surgeon, which I reacted to Day in the Life of an Anesthesiologist on his page. But yeah, if anybody else wants to see any more of these, feel free to let me know. I was planning on doing one more on heart surgeon or cardiac because that was the last specialty that, or I guess group that interests me, was anesthesia, dermatology, and cardio. I don't know why I forgot that. So if anybody else wants to see another reaction video, let me know in the comments below. And other than that, that is all I have for you guys today. Thank you so much for watching with me, and I will see you all in the next video. Don't forget to like, subscribe, and peace out.